Rural accountants are often the first people to notice farmers' mental health struggles, with a clear link between mental health issues, financial distress and the drought. And now they're being offered mental health first aid training so they can help their clients in crisis. Catherine Kennedy is Manager of Member Support at Chartered Accountants Australia and New Zealand, and she joins me now. Catherine, thanks for coming in. How did the idea come about?
We know that chartered accountants are at the front line in terms of dealing with people on the land who are going through drought and other natural disasters. But we had an event in Warrnambool in Victoria in 2016 when the dairy crisis had just hit. And we got very strong feedback from our members there that they were concerned about their dairy farming clients and that they were looking to us to provide them with some support.
So they were being asked to give emotional support, basically, or feeling they needed to and felt out of their depth, really?
Absolutely, and a sense that they didn't want to have conversations that might do any harm. There'd already been a suicide in the town, and you could see that they were very, very cautious. They're not trained to be counsellors or psychologists.
So the training that they're now receiving, what does it involve?
Well, we actually provided a range of support. We worked with Mental Health First Aid to develop some guidance for them, to help them have an awareness of mental health issues, to be able to recognise when some of their clients might be vulnerable, and then to give them some strategies to be able to have those conversations in a supportive way. So we're supporting the chartered accountants to support their clients.
And I guess they can really be on the lookout of it, knowing the state of affairs with a farmer, which he or she might be keeping secret from even family members, but for the accountant it's there in black and white.
The chartered accountants tend to have quite long-standing and close relationships with their clients, sometimes over generations. So I think they're in a good position to be able to sense when things aren't necessarily going so well. And they're also very well aware of the financial stress that the farmer might be under.
And particularly in drought times.
Droughts and natural disasters. So having had that experience in Warrnambool, we then talked to members in regional areas around Australia, and they said it doesn't actually matter whether it's drought, flood, fire, or a community that's transitioning from the mining boom. Right. When there are clients who are suffering from financial stress, they speak to their accountant, and the accountant needs support to have those conversations with them.
We know farming, there's been a lot of advances in farming, but it makes it quite isolating. Often machines can do jobs that otherwise people would be doing together. So I guess the contact with an accountant for some could be, all of the contact they receive for any period of time.
One of the things that the chartered accountants said was that often those clients, the dairy farming clients or the clients in regional areas, will have to speak to their accountant because they're in a situation of financial stress. So they're their first point of call, and they will often see their accountant before they see their doctor, which is one of the reasons that I think the accountants were feeling quite pretty much at the coalface in dealing with those issues.
And to be clear, with their training, it's to identify if a farmer is struggling, not to necessarily offer the full help, but to point them in a direction for that.
No. So the way that the mental health first training works is it tries to provide a sort of an equivalent to the St John's ambulance training for physical issues, and it gives them a strategy to be able to fall back on so that they've got a bit more confidence that they can have those conversations. But the focus of the conversations is really to refer those clients on to people who are trained in mental health.
And how have staff reported back after this training?
We've had enormously positive feedback. I think the chartered accountants are pretty relieved that they're getting that kind of support from their member organisation. It's a big issue. There are very few people these days who are untouched by mental health issues, and yes, they've really been very clear about their fact that they're very happy to get this from us.
That's a great program.
Yeah.
Catherine Kennedy from Chartered Accountants Australia and New Zealand, thanks for coming in.
Thank you very much, Gemma.